All right. Hi, everybody. My name is Ani King. I am the COO with allcounselors.com, and I am excited to be here today with Steve Lackey, who is our Director of Business Development and Customer Success. Steve has also got a lot of background as a clinician himself and was one of the first people we thought of when it came to talking about how to really look at the aspect of not only growing your business, but growing yourself as a therapist and clinician. Uh, we are excited to be kicking off an inclusive therapy series, which hopefully you will be able to attend or watch the replays for all of. Steve, would you mind telling the folks who are watching a little bit about why we wanted to do this inclusive therapy series and why it's so important for clinicians to start looking at these things?
Well, good. Thank you, Ani. It's really good to be here with you. This is a really exciting time, as well as a trying time. And I know a lot of people, the stress levels are up, anxiety levels are up. We're watching a clash of cultures, cancel culture. We're watching all of this convergence of a social, in my view, enlightenment. This is a time where, especially in the therapeutic community, in the clinical community, that we have to be much more mindful and broader in our approach to providing services to people who are hurting and seeking relief. But unfortunately, my experience has been that we have been taught to be this cookie cutter kind of machine where one size fits all, at the same approach, the same interventions, the same modalities. And that's not been as effective as it needs to be because it's at the exclusion of a ton of demographics. So I think our focus and goal is to move into a level of cultural competence and cultural empathy and responsiveness. And that, I know that's a big term, but it's very important. And I think this series is going to really open up people's awareness and maybe spark some curiosity around cultural competence and cultural empathy and responsiveness.
I agree. I'm wondering if you'd be willing to talk just for a second about what is cultural competence, especially however it relates to the therapeutic and mental health professional community.
Mm. Well, cultural competence is the overarching, the umbrella is cultural humility,
Mhm.
is being aware of what you don't know and not thinking that you have all of the answers for every demographic because you don't. Cultural competence and cultural humility actually is an inward self-awareness, an awareness that you do have limitations and that that's okay. Because what we're doing in this series is this isn't an indictment about what people don't know. This is basically, hey, let's take a deeper dive and look. So one is the awareness, this inward self-awareness. And I think I shared in the webinar with Corey that how to start a private practice about where my limitations were, the places that were red flags for me and that triggered some emotional response based on my history. So inward self-awareness. And the second one is owning the outward valuing of others,
Mhm.
being real conscientious about the cultural connection and composition of every demographic you're dealing with. And so it's an outward valuing and then upward growth. So are you willing to grow? Maybe you don't see at-risk inner city youth. Maybe you've never had as a client a trans or queer client. Maybe you don't have a clue about the Muslim community, and maybe you have some bias that you don't even know you have until you're in that environment. So outward growth. And so we look at it from a point of how do you develop that? How do you develop cultural competence and cultural humility? One is, as I said, the valuing of others, self-awareness and growth. but also mentioning one size doesn't fit all. Consider how your values, your worldview, your upbringing may influence your client's perceptions of, or your rapport with, or trust in you, because it's all about trust and relationship building. And then also ask yourself, are you being tolerant? Are you being, tolerance is acknowledging that there are differences between you and your client, huge differences, not better or worse, bigger or more, or capital I versus a small I. It's just noticing the difference and appreciating that, coming to embrace that difference as what I call a clinical moment. Because as soon as there raises in me an awareness of something I don't know, or I get some feedback from a client that I'm not real familiar with their cultural history per se, I recognize, wow, that's a clinical moment. I can use that to pivot into some deeper work. So yeah, those are some of the awarenesses that are, but and also being aware of what's happening outside of the therapy room. You know, so what does the client take back home, and what kind of response will they get based on their therapeutic experience? It's not the same for everyone. It really isn't. They may be waiting to see if you're uncomfortable bringing up racism, police brutality, and some of the things that we're watching in real time right now. And being aware to ask a client how they're holding up. How are they doing? So in other words, you're just acknowledging what is happening in the world and seeing their perspective and trying to get a view through their lens. And then lastly, don't make assumptions. Ask clients how they identify, period. What are the acronyms? What does that mean? What are the differentiations? And don't assume based on your client's outward appearance that they don't want to discuss certain topics, or they're able to relate to certain topics. So don't go in making assumptions and thinking you have to know everything. It's a learning process for both.
Thanks so much, Steve. I think that says a lot too around how for clinicians it is very important to do those self checks of what am I thinking? How do I feel about this? Am I centering my client, or am I centering myself because I'm uncomfortable with this topic or this area of a community that I'm not familiar with? What would you say, to anyone who's starting out with this series, would be a few good goals, some things that they should be able to walk away from after attending the series of webinars?
Well, the biggest thing I think is a broad view of the clinical universe that again, in school, it's this myopic view. You got Young, you got Anderson, you have all these modalities and all of these things that came out of mid-century Europe, with a European control where they got all their information from Freud on to Young. And it's like, no, there's a South African, there's an African, there's an Asian, there's a Central American point of view. So the idea is to expand your knowledge base and to grow. So no matter what you do, one of the takeaways is you're going to grow, because you're going to find out what you don't know. So be willing to expand that. And then secondly, learning how to hold space for others without it becoming a burden or a trigger for you. Learning how to sit in trauma and in the pain of others without it really affecting you at a deep level. You have to learn how to leave that at the office, and or learn toxic showers and learning how to relieve yourself of holding that space. But it's real important to have a space where people feel comfortable and trusting. So take away the fact that you can hold space for people for as long as they need you to, and then allow them the freedom not to feel shame or embarrassment or uncomfortability about what it was that they've shared with you. And then I think lastly, the biggest takeaway is that, you can literally recreate, reinvent, modify, codify. You can really expound on so much. And it's through your own prism. It's like your prism of experiences. So I may talk about microaggressions and getting on an elevator and watching people go into the corner or clutching a purse or listening to a door lock. Well, other people have other types of experiences. And so it's real important to stay curious. I remember when Corey, and I first started talking, I kept saying, just be curious, ask questions, just stay curious. So those I think are the biggest takeaways I would like to offer.
Thanks, Steve. I agree. I think that for everyone who is attending, our request would be, come curious, come with questions, come prepared to learn about things that you don't know about. And hopefully, one of my goals for everybody who's doing this is also that it will propel you into learning more about the communities that you're working with or want to work with, and just doing the work. We're certainly not going to be able to teach you everything that you might need to know in a 1-hour webinar, but we might be able to get you on the right track if you really know, hey, I want to work with children and adolescents, or hey, I am really called to work with the LGBTQIA community. That it can help you understand a little bit about where to start and why it's important, so that you know where you fit within that mission. So everybody, I hope that you check out all of the webinars and that you find them helpful and useful. Steve, is there anything you'd like to say to our future audience before we sign off?
Yeah, I would like to say one that, make sure you give yourself the hugs, the pats on the back, and the self-motivation and the kudos that you need. You may not get it from anyone. You may not even get it from a client, but give it to yourself, because this isn't easy doing the kind of work that you're embarking upon. It's not easy, but what you'll realize over time is it's sacred. It's sacred for the client, but it's also sacred for you. So you want to hold on to that, because that then becomes the motivation for doing the work you do.
Thank you so much, Steve. Folks, feel free to start signing up for the webinars as they pop out. We look forward to seeing everybody in the audience. And we especially, along with our presenters, look forward to your questions. We will have a series covering working with the Jewish community, the Muslim community, the LGBTQIA+ community, women in specific, Black and other people of color, largely focused in the United States, but we'll try and get a little broader than that too, as well as looking at working with folks who are in the Asian American and Asian Pacific Islands. So we will also look forward to adding more and more to this series as we go. If you happen to think that there is a topic we're not currently presenting on, that would be really beneficial to either communities you serve or work with or are a part of, feel free to drop an email to Ani, A-N-I, @allcounselors.com. Thanks so much, everyone.
Thank you.